of you on behalf of the organizers. First, thank you to the organizers, Dr. Lunia and Dr. Prashant Nyati, for giving me this opportunity to talk to all of you about a disease that is very close to my heart, something that I treat on a regular basis. I would like to modify what she just said. I am not a gynecological surgeon. Dr. Prashant Nyati is. I am a cancer surgeon and I deal with breast and colorectal cancer, but my predominant interest is breast cancer, and that's why I'm going to talk to you a little bit about it. Our slides are being projected there, all right. If you can see from the slides, women's cancers are on the rise, there is no question about it. Once upon a time, cancer was not a disease of India, but today we know for sure that this is a cancer that affects the Indian population, and it affects the Indian population in huge numbers. To put the thing in perspective, about 10 to 12 years ago, if I rewind my life back, and I think I had only one relative, an aunt of mine, who had died of breast cancer, and nobody else in a huge family who had even was diagnosed with cancer. And today, I have 13 patients apart from that one aunt who passed away, out of which 3 women with breast cancers whom I myself have operated upon. So if it is affecting my family, if it's affecting me, I'm sure all of you are in the same boat, and you also now know many people, many close relatives, friends who have been diagnosed with this disease and are taking treatment or have been cured of this disease. Till about 3 years ago, the most common cancer affecting the Indian women was cancer of the uterine cervix, so that's the mouth of the uterus. But today breast cancer is the number one as we stand in 2012 in the urban as well as the rural areas. It has overtaken, is approximately 1.8% per year, and actually in the younger population below 50 years of age, this multiplication factor is even higher. The Western data shows that it's as much as 5%. Nobody has really calculated the Indian data, but we would be probably close to 2.5% per year increase year on year. It is expected that by 2025, India is going to be one of the top 2 countries when it comes to new cases of breast cancer getting diagnosed. So we better understand what causes this cancer, how can we prevent it, what is the treatment available, can we cure it, the basic things about this cancer, make ourselves aware so that we can take the right steps to diagnose cancer early. God forbid we have to get it. If you look at this slide, the lifetime risk of an Indian woman getting cancer in the urban areas is 1 in 16 women. Until 5 years ago, it was 1 in 27 women. So it has come down from there, 1 in 27 to 1 in 16 in a matter of 5 to 6 years. That is the rapidity at which this cancer is growing. The incidence is 28.1 per 100,000 women. So let's not panic. I'm going to say a lot of morbid things here, but remember, out of 1 lakh women, only 28 get. But this 28 number is going to become 40, and is going to become 100, and is going to become 150. And we always would like to believe, like, every smoker who's standing at the panwala, he smokes, there's somebody else smoking next to him, and he thinks he's going to get cancer, I'm not going to get a cancer. So it can very well be us or somebody very close and dear to us. So we should understand that this cancer is on the rise. Having said this, if God were to come into anybody's dreams and say, Mrs. XYZ, I have unfortunately decided that you have to get a cancer, but I'll give you the option to choose. Of course, you should try and choose thyroid cancer because you can't actually die of a cancer. But if God says, there is a waiting list, many people have already selected it, you have to select another one. The one that you should be selecting is breast cancer, because across the board, if you diagnose it early, 80% of women at least will get cured. So you will have 80% and upwards cures. You treat 100 patients, 85 and 90 women get cured of the cancer, provided you diagnose that cancer early. But if you allow it to grow, for whatever reasons, you don't seek treatment out of shame, out of fear, out of anything else, then the cancer grows, becomes locally advanced, and in spite of our best efforts, only 50% of women will get cured. So we have to understand that if somebody has a painless breast lump, you have to rush to a doctor and get yourself examined and diagnose a cancer if you have a cancer. But you don't need to panic every time you have a lump, because 9 out of 10 times it's not a cancer. So it's very harmless to go to a doctor, get yourself investigated, prove that you have you don't have a cancer, so you are very happy, or if you have a cancer, you have diagnosed it when it's early, so 85 to 90% chance that you are going to be cured. Fear has no place in such symptoms. Why are we seeing cancers? Why are we seeing breast cancer? We have to understand that there are some known causes or some known etiological factors of cancer, of breast cancer. Age and sex, being a woman and being a woman who's advancing in age are the two most simple, two most important high risk factors for breast cancer. In other words, you can see that box on the right side. As your age increases, the risk just keeps on going up. And why does this happen? Because the breast cells are constantly dividing, they are constantly being acted upon by female hormones. The more the number of divisions, the longer you live, the more number of cell divisions, statistically higher chance that one cell division is going to go wrong and one of those baby cells is going to be a cancer cell, and from then on a cancer will start growing in your body. Do males not get cancer? Yes, males can get cancer, but it's only 1 in 200. So for every 200 women who get cancer, a man can also get breast cancer. And I have 2 husband-wife couples who follow up with me who have breast cancer. Very strange, but they come together for a follow-up and get examined together. The second most important, family history. If you have a strong family history, if you have one first degree relative who's got a breast cancer, it increases your risk of getting breast cancer. If you have 2, it increases it further. If you have one who has got breast cancer on both sides, or a breast cancer and an ovarian cancer, it further takes up your risk. The point I'm trying to make is, if you have family history, you need to be more vigilant as compared to your neighbor. Having said this, understand one bottom line. Just because your mother or your sister got cancer does not mean you have to get a cancer. So if you have a risk of 1 and your mother has got a cancer, your risk may go to 1.5 or it may go to 2, but it is not 100%. You will not 100% get cancer, but that does not mean that you should be less vigilant. You have to be vigilant, because compared to another woman of your age who does not have a mother or a sister with breast cancer, your risk is going to be high, and that's why you have to be very careful about it. We hear about lot of genetic mutations, BRCA1, BRCA2, hereditary breast cancers. Please remember, they do not account even for 5% of cancers all across. So you don't really need to get paranoid that there's something happening in our genes that's making us prone to cancer. Not at all. The main risk for cancers actually are the next 2 following slides: hormonal factors and lifestyle factors. And it's because of these 2 factors that cancer of the breast is going up. I'm just going to flip you back a couple of slides. If you look at the lifetime risk of an American woman, it's 1 in 6 women who get cancer. Urban Indian women, 1 in 16. And if you look at a rural Indian woman, 1 in 55. So in the same country, we have 2 different incidences or lifetime risks of cancer. So if you can see, progressive urbanization, the more you try to be like New York, the more you change your behavior, your lifestyle, your reproductive habits, the higher the chance that you are going to get a cancer. And why? It's because of hormonal and lifestyle factors. We know very well for last so many years that if you have a long reproductive period, in other words, you start your periods early, or you end your periods late, or you end your periods early but keep on taking hormone replacement therapy to make yourself feel young, so you are again exposing your breast to a lot of hormones, it increases the risk for cancer. Today, we are seeing young girls coming to us starting their periods as early as 9 and 10, which was not happening in the past. Starting periods early attack of estrogen on the breast cells, higher the risk of cancer. Now this is something that we really can't modify, but we should understand that this is one of the causes. Not having children but having them very late, beyond 30-35 years of age, having children but not breastfeeding them or breastfeeding them for a short period of time, all of these hormonally affect your breast and increase the risk of getting a breast cancer. To make it very simple, whenever a lady gets pregnant, she goes into a progestogenic phase where progesterone increases more in the body, estrogen reduces in the body, and that is where estrogen, which is the real stimulating factor that may increase the risk of getting a cancer in your breast, goes down. So you get a break for those 9 months. Then if you continue to breastfeed, breastfeeding does not allow you to get your periods. It causes lactation amenorrhea. Why? Because it suppresses the estrogen. So your progesterone level is still high, protective action on the breast. So you have to have children I'm not saying you have to have, I mean, but if you have children and if you have two children and if you are able to breastfeed, that is going to help reduce your risk. Should you believe it just because I say it? No, there is enough retrospective studies that have been done and they show that if you have your first child before 25 years of age, two children before 30 years of age, and you breastfeed both your children for 1 year, at least 6 months, if you can't do it for 1 year, it reduces the risk of getting breast cancer by 50%. Now, how many people really know that? Most of you may not be doctors. I am a doctor. I have gone through MBBS, and my children are born when my wife was 29 and 33. Now you will say, I'm standing here and giving you all these big rags, but I have not followed it myself. The unfortunate part is this is something that was not stressed to us at that time, probably because it was not of epidemic proportions. This disease was not of epidemic proportions then. But even being a doctor, I was not aware of this. The only point I'm trying to make here is, please register it in your minds that somewhere we have to understand that physiology is important. You have to have children on time, and you have to breastfeed them for a good bit of time to not only help the baby, because how does it help the baby? Long breastfeeding, the baby gets good immunity, there's a good maternal bonding, and these children are known, Dr. Joyita will agree with me, are known to have a very high level of self-esteem. So the baby benefits and the mother benefits by reducing her risk of breast cancer. So one should understand that, at least propagate this message. If there is somebody who wants to follow this advice, at least should know, I didn't know it, I couldn't follow it. But when I found out, we have ensured that both our sons have been breastfed for 1 year, and my wife is a very busy doctor in the city of Bombay, but still she would take time out, come home, breastfeed, go, or use a breast pump and go. Why did we do that? To try and reduce the risk of breast cancer. I'm not saying she's immune. God forbid, she may get a disease later. But we have done everything in our ability to try and reduce, and this is something that one should understand and propagate. Lifestyle factors. The more and more we earn, the more and more we get affluent, the better and better we eat. High dietary fat, consumption of alcohol, increasing body weight because of lack of exercise, increased incidence of diabetes mellitus. We are expected to be the world's capital of diabetes mellitus by 2020. Indians are going to be right at the top there. So imagine all these factors increase the risk for cancer. Now let me put the whole thing very simply. Think about a rural Indian woman. She gets married at 17, 18, 19, has her first child at 19 or 20. She has no access to fancy foods. She can't afford it. She can't afford the Nestle's and the Cerelacs. So she breastfeeds her child for 2 years. Then she has her second baby by 22, 21, 22. Again breastfeeds for 1.5 to 2 years. Every day in the morning she wakes up, makes a simple breakfast, something very simple, not too fatty, no Pepsis, no diet Pepsis, no alcohol. Packs a lunch for her children. They are also eating healthy. She's also eating healthy. She draws water from the well, lot of physical exercise. Goes to the field to help her husband, helps him in the field, again physical exercise. So she's eating well, she's doing a good bit of physical exercise, she's not obese, she's not taking a lot of dietary fat, she's having children on time, she's breastfeeding her children. The result? She has a 4 times lower incidence of getting a cancer. I'm not saying that we have to go back to hand pumps, but one thing that we should understand is exercise, eating the right food, doing everything in moderation, and understanding the hormonal impact is something that is very important. And if we understand this, we will be able to reduce the incidence of breast cancer, not today but 25 years from now, if we start it today. As far as what is to be done in these 25 years, I will cover it. We have to detect those cancers early, so that is where screening or early detection comes in. How do cancer patients present? More commonly with breast lumps. Sometimes they may come with blood-stained nipple discharges, and sometimes many other symptoms that we really don't need to go into details of. So the most common thing is a breast lump. Sometimes you may not have a breast lump, but something may happen to the skin of the breast. So if you really look at this lady on the left top, this lady has got a thickening of her skin and she's got a lump in the armpit. She's got a deep-seated breast cancer with a lymph node involvement, and her skin starts becoming thick. So just because she didn't feel a lump, she never went to a doctor. But if there is a change in the texture of your skin, there may be a cancer, so you need to visit a doctor. The lady in the center, her left nipple is retracted. She has a small cancer behind the nipple and areola which is pulling in the nipple. So she can't feel a lump, but there is a nipple retraction. So there is a change in the breast. It is not a lump. She needs to go to a doctor, get herself examined. There may be a cancer. The lower one also looks at skin thickening with a nipple retraction. These are some rare presentations of cancer, but the most common ones are painless lump in the breast. And if you have a painless lump, most women said, come to me and say it was not paining, so I didn't do anything. If it is not paining, rush to the doctor. All the more reason that you should go to a doctor. Sometimes you may have, the nipple will be normal, the skin will be normal, but the skin may just get dimpled. If you really look at the right breast of this lady, the lower end of the skin, the skin is just getting pulled inside. Why? Because there is a deep-seated cancer that is pulling in the skin. This is the earliest sign of cancer, and if it is ignored, one may pay a price, because this cancer may just grow and we may diagnose it at a little advanced stage. So if you really see what I showed you in the last few slides, is that it is very important for you to be vigilant, very important for you to examine yourself, not only by palpation, by feeling if there is a lump, but before you start that, look at yourself in the mirror and see, is there a retraction, is there a skin thickening, is there a dimpling, is there a redness? Now this is important. A visual examination when you are taking a bath is very important, because you can pick up cancers very early. Sometimes some women get ulcerations of their nipple. They go to a skin doctor, they treat them with steroids, still doesn't get better, but they feel anyway it's a skin infection, I might just ignore it. This can be the earliest sign of a cancer. It's called Paget's disease, and if you have Paget's disease, it's 100% curable. So if you go to a skin doctor, he or she gives you a medication and this ulceration does not improve, the next person you have to meet is a surgeon and you have to get a biopsy done of that nipple. What do we do? When we get a patient who's come to us with a lump, we have to get a diagnosis. So we take a small needle and put it in the lump, take out a few cells, put it on the slide and see whether there is cancer. It is called a fine needle aspiration cytology, and we do something that is called as a mammography, because we want to see where all the disease is. Is the opposite breast also involved? That helps us decide how to treat the patient in the future. CT scans, bone scans, sonographies, PET scans that you keep on reading about and hearing about all the time in the newspapers are not essential when it comes to early cancer. So if you have a tumor which is less than 5 centimeters, you don't need any of these investigations at all, because you have an early curable cancer and you don't have to do. So not only does it help save your life, saves your money also and stress by not doing all these tests. Cancers are broadly classified as operable, the early ones which get cured, the locally advanced ones which can get cured only 50% of times, and metastatic. Some women ignore it for such long periods that the cancer spreads to the bones and lungs and liver, and unfortunately at that time this cancer is not curable. So we have to understand, like Dr. Lunia said, that early detection screening is the most important. The earlier the stage, you can see in the table, stage 1, 2, 3, 4. Earlier the stage, lesser the treatment. So if you have stage 1 cancer, you require only loco-regional treatment. So surgery and surgery with radiation, very rarely you may require to give chemotherapy. If you have stage 2, if you have allowed it to grow to stage 2, then you require local and regional treatment, but you also require systemic therapy. So you require your chemotherapy, you require your hormone therapy, you require multiple things. If you allow it to go to stage 3, that is locally advanced, then it's so big that you can't really operate. Now you have to give chemotherapy first, make it small, operate, give chemotherapy again, and give radiation therapy. And in spite of doing this bit of work, 7 to 8 months, only 50% women get cured. The basic understanding in this slide is that the earlier you detect, the lesser the treatment, the lesser the investigations, the lesser the cost, and the best survival possible. So it is very important we understand that we should treat ourselves, diagnose ourselves and treat ourselves early. A few slides on what do we do for treatment. Dr. Tejinder is going to talk about chemotherapy and hormone therapy for you. So I'm not going to really duplicate that. I'm just going to talk to you some things about surgery. In the basic aim of surgery is to take the cancer out and to take the lymph nodes out, because cancers go to the lymph nodes in the armpit. So identify if it has gone there by doing a technique that is called as sentinel node biopsy. If it has gone there, you take out the nodes from there and treat the patient. Previously, we had to take out the whole breast, modified radical mastectomy. Today, we don't need to do that. And this is one of the best advances today, that you get to save the breast and you get your cures. And for that, we need some really good assistance from radiation oncologists like Dr. Balawat, and I'm sure he's going to talk about that if we save the breast, then he will give radiation therapy to the breast so that the cancer will not come back in the breast. So 2-3 doctors coming together and treating an early cancer, you get to save your organ and you get to save your life. So today, cancer treatment is changing, lesser and lesser and lesser, for better and better and better outcomes. So if you see, if you are able to detect your cancer early, the benefits of early detection are that the tumor is small. So instead of a mastectomy, taking out the breast, you can save your breast. The left side picture is something that we call as oncoplastic breast cancer surgery, where we combine principles of plastic surgery with cancer surgery. We hide all scars. So this lady, you will not even make out has been operated for breast cancer. This is how far we have progressed when it comes to cancer therapy. But it is useful and it's possible only if the cancer is detected early. So if you detect it early, you don't get a mastectomy, you get a small operation. You don't get chemotherapy and all its horrible side effects. The best quality of life, and you get the best possible cures. So whenever you have a patient whom you treat, you are going to start with the basic investigations, do the surgery, and then plan whatever needs to be done, and that bit of it is going to be taken by them. So how do we diagnose our cancers early? My last few slides, we have been stressing that if we diagnose cancers early, we are going to cure more and we are going to treat less. How do we diagnose them early? Very simple. Only 3 ways. Either you are going to diagnose it for yourself, or I am going to diagnose it for you, or a radiologist is going to diagnose it for you. So it's either breast self-examination that you have to do, or you have to do a clinical breast examination. You have to go to a doctor and get yourself examined. Or 3, you have to get a mammography and a sonography done. The gold standard accepted today is to get a mammography and a sonography annually, once a year, starting 40 years of age till you are 75 years of age. So you have to get a mammography done and a sonography. Most guidelines will only talk about mammographies because most of these guidelines come from the West. From the West, you should understand that 60 to 65% of their population is beyond 50 years of age. They are older women, and in older women, mammography is a beautiful tool. But in younger women, in a country like ours, where 85% of the population is below 50 years of age, a mammography in itself is not sufficient. You have to do an additional sonomammography, a sonography of the breast. I have had patients who have come to me with lumps who are this big, and I ask them, okay madam, how long have you had this lump? And this lady will tell me, I have had it for almost a year now. I said, if you knew you had it for a year, what were you doing? So she says, I went 1 year ago to a local mammography center. They did a mammography and they said it's normal. They didn't do a sonomammography. In a younger woman who has a very dense breast because of lot of active parenchymal or lot of active glandular tissue that can make milk, small cancers can be missed. So she had a cancer and the mammography missed her cancer. And why did it miss? Because the sonography was not added. So for us, starting at 40 years of age, a mammography along with a sonomammography performed annually is the correct way to screen ourselves. How do you do breast self-examination? Breast self-examination is one of the most simple and the best ways, cheapest ways, free, because it's absolutely free unless you want to pay yourself. Okay? It should be learnt at home. It should be started when you are 20 years of age. Why 20? Not because you're going to get cancer at 20 and 25, but by the time you reach 45 and 50, when you're going to get a cancer, you are so well accomplished at examining yourself that if you have to, God forbid, get a cancer, you are going to diagnose it when it's so small rather than when it's going to become this big. So breast self-examination is absolutely recommended to be done. And when do you do it? For women who get their periods regularly, you should do it 1 day after your periods stop, because that is the time when the breast is the least nodular, is the most supple, is the least painless, and that is when you are going to pick up cancers early. If you are postmenopausal, if your periods have stopped, then you can take any 1 day of the month and just do it. It has to be done once every month. Not more frequently, not less frequently. I ask women and they say, doctor, every day I take a bath, I look at myself and I examine myself. I said, I'm very happy you are very alert, but please remember, examining yourself every day does not help. Why doesn't it help? I go home every day. I have 2 boys. One is 7, one is 4. I can't see them growing tall because I see them every day. But when my mother sees them once in 2 months, she says, both of them have grown tall. This guy has grown fat. Now why? Because there is a gap, but I can't see it. So if you are examining yourself every day, there'll be a lump and you'll say, this was there yesterday, I don't need to be worried about it. But if you're going to examine yourself once a month only, you'll say, I'm sure this was not there last time. This is something, let me go to a doctor and get myself checked. Maybe it's normal, but I want to get myself checked. So once a month is very important. Okay? Remember, still 90% of times it's not going to be a cancer. So just because you feel a lump, don't press the panic button, just go and meet the correct doctor. Because God forbid you are in the other 10%, you have still accomplished something, you have diagnosed that cancer very early and you are going to be cured of your disease. For breast self-examination, these are some of the photos, but if you go on the internet, there are plenty of websites where you'll get photographs as well as small videos. So please, I urge you to go back home today, go to your internet, look at all these things and start practicing it. It should preferably be done in the bathroom where you have your privacy. You have a mirror in front of you. I explained to you why you need a mirror. Before you start examining yourself with the hand, you have to first look at yourself, because there are some cancers that are just diagnosed by just looking at the breast. So you have to inspect yourself and then start feeling. Take a little bit of soap and water on your hands so that your hands become very slippery, so that they just glide over the skin of the breast and the smallest of lumps can be very easily detected. Practice makes a man perfect. It has been shown that once a lady does breast self-examination for 15 times, so it will take more than a year, but more than 15 times, she's an expert and nobody knows her breast better than her after the 15 months. So just start it this month onwards. The last technique is to go and meet a doctor. Below 40 years of age, it is recommended that you go and get yourself examined by a doctor, be it a surgeon, be it a breast surgeon like me, or a gynecologist who's accomplished in examining the breast. Okay, once in 3 years. Beyond 40 years of age, you should do it once a year. So to sum it up, screening, you have to diagnose your cancer early by first starting doing breast self-examination at 20 years of age, once a month. You should go and see your doctor once in 3 years and get yourself examined till you're 40, and after you're 40, once every year. And you should get a mammography and sonography starting at 40 years of age till you are 75 years of age. You can even start early if you have a strong family history. So if your mother or sister has got it at 42, you don't need to wait to 40. You have to go minus 10 and you start at 32. Okay? I think this is my last slide. Thank you very much for a patient hearing.